Hi class, this is an overview of the pediatric patient with respiratory disease. There are many respiratory diseases that the pediatric patient experiences. These include croup, acute bronchiolitis, respiratory syncytial virus, bacterial pneumonia, cystic fibrosis, and asthma. The first respiratory illness that we're going to talk about is croup. Croup occurs in younger children anywhere from 6 months to 3 years, and it occurs because the airways are very small and they're very susceptible to infection. Croup is an infection of the upper airway which obstructs breathing and causes a characteristic barking cough. The cough is the result of swelling around the voice box, the windpipe, and the bronchial tubes. When a cough forces air through these narrow passageway, the swollen vocal cords produce a noise similar to a seal barking, as you can see this baby is doing. Croup is normally caused by a virus or parainfluenza virus. Some croup symptoms are upper respiratory symptoms for 1 to 3 days, low-grade fever, barking cough or hoarseness, inspiratory stridor, a cough that is worse at night. The child prefers to sit up and is aggravated by agitation and crying. Management of viral croup is usually cool mist air, oral steroids, and sometimes epinephrine. The next virus infection we're going to talk about is respiratory syncytial virus. Respiratory syncytial virus causes mild cold-like symptoms in older children and can cause serious problems in young babies, including pneumonia. Respiratory syncytial virus is caused by a virus. The symptoms are fever, stuffy nose, cough, trouble breathing, decreased interest in their surroundings, listlessness, irritability, poor appetite, and apnea. RSV may require O2. The child is usually not given antibiotics because it is a virus, and symptoms usually improve within 1 to 2 weeks. The prevention of RSV is covering your coughs and sneezes, washing hands frequently, not sharing cups or utensils, and avoiding contact with people who have a cold. As I said previously, RSV is caused by a virus. Some RSV symptoms in babies. Babies may refuse to breastfeed or bottle feed. They're usually upset or inactive. They have trouble breathing or shortness of breath. You can see their intercostal muscles going up and down, and their cough is producing a yellow, green, or gray mucus. Some signs of dehydration in a baby are no tears when crying, fewer wet diapers than normal, and cool, dry skin. Preventing RSV, as I said, is keeping your hands clean, keeping toys and blankets and sheets clean, avoiding crowds and young children during RSV season, which is anywhere from October through April or May. No smoking, and steering clear of people who have respiratory illness. Treatment of RSV is generally supportive, as I said, fluids, oxygen, antipyretics, ribavirin. The next illness that we're going to talk about is bronchiolitis. Bronchiolitis is a disorder most commonly caused in infants by the viral lower respiratory tract infection. The most common lower respiratory tract infection in children from 1 month to 2 years is bronchiolitis, and is characterized by acute inflammation, edema, and necrosis of the epithelial cells lining the small airways, increased mucus production, and bronchospasm. The pathophysiology of bronchiolitis is the bronchi and the bronchioles become plugged with thick mucus, causing air to be trapped in the lungs. The child can breathe air in, but has difficulty expelling it, which hinders gas exchange, and causes symptoms of a runny nose, congestion, cough, low-grade fever, difficulty breathing, wheezing, and otitis media. In this picture, you can see some of the pathophysiology of bronchiolitis that I just described. The treatment of bronchiolitis is oxygen, suctioning, fluids, careful monitoring, and they don't routinely indicate antibiotics. The next disease process we're going to talk about is bacterial pneumonia. Bacterial pneumonia is an inflammation of the lungs caused by bacterial viruses or chemical irritants, and it is a serious inflammation in which the air sacs fill with pus or other liquid. Bacterial pneumonia can be caused by various bacteria. Streptococcus pneumonia is the most common cause. Other ones are Group B Streptococcus, Staphylococcus aureus, and Group A Streptococcus. Some symptoms of pneumonia is a productive cough, pain in the chest, vomiting, diarrhea, decreased appetite, fatigue, fever, stomach pain, chills, breathing faster, hard, headache, and fussiness. The diagnosis of pneumonia is usually on a physical exam, a chest x-ray, a blood test, sputum culture, pulse oximetry. The treatment, respiratory support is indicated with either O2 or positive pressure. Treatment with appropriate antimicrobials, ampicillin or gentamicin or ampicillin. The next illness that we're going to talk about is cystic fibrosis. Cystic fibrosis is the most common and serious genetic disease in Caucasian children and is a chronic condition that affects the lungs and digestive system of the body. Children with cystic fibrosis may have chronic lung infections and poor digestion of their foods. 1 in 25 Caucasians is a carrier of cystic fibrosis. Diagnosis is through a sweat test, where sweat is collected and salt content is measured. Cystic fibrosis becomes present when there's a defective gene, usually related to a protein that is involved in chloride ion transport. Patients with this disease develop an unusual sticky mucus plugging that clogs the lungs and causes obstruction, which leads to life-threatening lung infections and also obstruction in the pancreas. Some symptoms of cystic fibrosis are persistent cough with productive thick mucus, wheezing and shortness of breath, frequent chest infections, sinusitis, nasal polyps. Children with cystic fibrosis also have some digestive symptoms, bowel disturbances, weight loss, and they don't digest their food well. Treatment of cystic fibrosis is a diet that's high in calories and high in protein, chest PT, pastoral drainage, breathing exercises, aerosol therapy, antibiotics, vitamins, bronchodilators, and pancreatic enzymes. Children also experience fatigue, chronic cough, recurrent upper respiratory infections, and chronic hypoxia. In later stages of cystic fibrosis, you also see clubbing and barrel chest. This picture is just an overview of cystic fibrosis. The next respiratory disease we're going to talk about is asthma. Asthma is a spasm of the bronchial tubes caused by hypersensitivity of the airways in the bronchial system and inflammation that leads to mucosal edema. Asthma is also referred to as reactive airway disease. Asthma attacks are triggered by hypersensitivity response to allergens. Asthma triggers include allergens, upper respiratory infections, colds or flu, certain weather conditions like cold air, exercise, and emotions. Asthma can be intermittent with extended periods or it can be chronic. Clinical signs and symptoms: difficulty breathing, shortness of breath, sleeplessness, wheezing, chest pain, coughing after exercise, or the cough can be exercise-induced, and chronic cough. Some causes of asthma are cigarette smoking, medications, dust, environmental allergens, pollution, foods, stress. Some treatments of asthma are bronchodilators to eliminate allergens, corticosteroids, nebulizer treatments, and chest PT. These are my references. This concludes my overview of the unit pediatric patient with respiratory disease.